Then we're going to stay in here, we're going to do one more panel, and then we're going to move rooms and have a break. But if anybody has questions for our distinguished panel, please.
What can we do in SSDP to try to further the Weill-Kricher discussion?
Well, the question is what can you do to help out with Weill-Kricher? There's a lot of different strategies. There's one strategy that yesterday the Americans for Safe Access has gone to Congressman Olver, John Olver, whose district is UMass Amherst. And he's going to be sending a letter to Ogden, who's the Deputy Attorney General, who's directly in charge of DEA. The letter is going to be from members of Congress saying, ask the DEA, we want the DEA to just accept the administrative law judge, a recommendation, give them the license. Or at least we want to hear it. So that what you can do is speak to your different congressional representatives and ask them to sign on to the Ogden letter. We only have till April 15th to get signatures because we're working within this time frame of April 13th is when the DEA lawyers have to submit their proposal, and then May 1 is when the final ruling comes into effect. There's other strategies that I've talked about with Aaron, I've talked about with Ethan Nadelman, of sort of talking directly to Obama administration people and saying, you know, this is an issue of science over politics. And so I think for now, the things that can be done would be to call your congressional reps and get them to sign on to the Olver letter. Particularly if you have a rep that's a Republican. That's what we really need. I mean, there aren't any messages, so you guys are from all over. That's what we most need. But that's the best way to help right now. And then we'll see what happens. Because if we lose, if the final ruling comes into effect on May 1, I'm great comfort in the fact that MPP and Drug Policy Alliance and others will continue the work that Jesse talked about, that Mike talked about in the states. But we'll be lost in court, in appeals court, for years. So if we don't get it now, it's just going to be up to the states for a long time. Or else, more pressure to get the Obama administration to just reverse the whole thing again. But if they're not going to reverse it now, I think they'll just say, hey, we got too many other issues. If that's what they say, then we're sunk for years.
The end to marijuana prohibition is presented mainly on medical, industrial, and recreational arguments. Do you think marijuana or cannabis as an entheogenic substance should be further utilized in the fight against prohibition as a spiritual substance?
Well, I guess you all heard that. The question is, you know, marijuana can be used spiritually too, and we're focusing mostly on trying to end prohibition through medical use or through, you know, recreational use. So I think that the spiritual use is a really good approach because, but it's not going to be the leading edge, because to say that a drug has spiritual use, there's just been cases for the Santo Daime that use ayahuasca that they just won. There's two different groups. How many of you know about ayahuasca? It's a psychedelic drug from Amazon and it's used for religious purposes. But they've done their very best to limit it to those particular groups. So we've talked about the drug war as a fundamental affront on human rights and individual pursuit of their own personal growth and spirituality. And so when you talk about spiritual use, it's too much like legalization. I mean, it's not bad, but it's like legalization. It's why should you have to have your spiritual use go through a group? Each individual should be able to pursue their spiritual understanding as best they can. So medical marijuana, it's for patients. You know, even you know, so recreational is sort of the same as, but talking about it as a spiritual thing helps to talk about positive uses. It gets it in the discussion. It's not all just about frivolous stuff. So I think it's important to talk about it, but for practical political developments, I think religious use will come at the same time that that recreational use will come, and medical will come first.
Just on the politics of legalization, I think the big hook right now is the budget. In Massachusetts, we have about we have a 1/6 of our total budget is in deficit. For every $6 that we spent last fiscal year, we now have $5 in income to cover it because of the drop in revenues and the increase in the cost of everything that cost $1 last year, cost $1.10, $1.05 this year. And in every single state, that situation is being replicated. And right now, for the next fiscal year, there's some short-term federal stimulus money that's coming in to help float the boat of state revenues, but there's still going to be budget cuts. In 2010, 2011, when the revenues are still going to be going down and there's no federal stimulus package at the state level, the amount of cuts that are going to be faced by state legislators is going to be absolutely horrific. No community daycare for disabled children, gone. All of these things are the level of wiping out people's ability to hold a job is what's being faced at the state legislative level in every single state, not just in New England. So now is an absolutely critical time, these next 2 years, to make the budget argument to people that, you know, if we're taxing and regulating toxic substances, and the taxation and regulation of those substances make them less accessible to children than marijuana, now is the time to begin to flip this, not just to protect children, but to save families from, and to allow the kind of state services for firefighters and police protection and teachers that we just simply can't afford without a brand new source of revenue.
Since this is a medical issue, like politicians, I don't feel are really qualified to make the decision whether it should be allowed or not. So why aren't doctors the ones who are really like deciding this, since they're the ones who are most qualified?
That's a two-part one. Doctors, how can the politicians? Both very good points. First answer is we can do as much as we can to bring healthcare professionals into the process. You're right that politicians should not be entirely invested with the choices about what people can or can't put in their bodies. And we definitely need to do as much as we can to make sure that doctors and nurses play a role in the political process. You can talk to your doctor about testifying at a state hearing. You can talk to a nurse or a representative of a nurses association about becoming involved in a political process when there's a bill affecting your or other people's health working its way through the legislature. And other than that, there's how come the politicians get so much say? They're not the experts. And that's actually worked well for us sometimes. If politicians are not the experts, then they're ready to roll over and do the right thing and listen to doctors and nurses. If you can tell a politician, you know,